What is the best skincare for mature skin, my age and older? I'm Dr. Angela Sturm. I'm a facial plastic surgeon. And skincare is always a hot topic because it's something that we can do to help ourselves look better, to feel better. It feels good to do it. We look better and it's very accessible. Not everybody's going to go out and get a facelift. Not everybody wants to do that, but it's something we can all do to go get a cream or try out a serum and it feels good. You're taking care of yourself. You're taking that time out of your day to take care of yourself and do something for you. So with so many products on the market, how do you even decide what you're going to buy? And you go in for a consultation and you may come out with thousands of dollars of recommendations. And unfortunately for me, the more options you give me, the less likely I'm actually going to do it. If you're the 12-step skincare queen, that's wonderful. And I'm super excited for you. And I'm kind of want to know how you can maintain that. But I would say most of us probably aren't. We're in the 1 to 3, maybe 5 products that we can consistently use and see a difference. And I honestly think that that's all it takes, is it takes consistent use of your handful of products that work for you, that work for your skin, work for what you're wanting to do, and good quality products. Just spend the money on those 1 to 3 products that you're like, these are really good. Not have to worry about the whole bathroom of things you have full of everything that you go to Sephora and you come back with bags and bags of things. Medical grade does make a difference if you ask me. I think it does matter that those are products that they have done clinical studies on. They have papers that they can show you. They have usually been done by the company, and so you take that into consideration when you read the results, but they have actually studied it as opposed to products that really don't have to prove any sort of safety or efficacy or anything like that to the people that are selling them or the people that are buying them. So I think it is worth that because they've put that time and money and effort into making sure that it does deliver for their patients. I don't think that you have to have a 12-step routine, but I think it is important to have a really good cleanser. There is some data that cleansing twice a day may or may not be the right thing for you. This is something I saw recently. That is the traditional teaching, is morning and night. If that is working, don't change it. But if you have drier skin, you may not necessarily do that. And I'm kind of excited to see that result because 2 small kids, sometimes it happens, sometimes it doesn't happen. But obviously a good cleanser is important. And then I feel really strongly about moisturizers. I think everybody should find a moisturizer that works for them. If you have oily skin, sometimes if you don't moisturize, your skin is overproducing, trying to make up for that. And so even though it feels counterintuitive, finding one that's nice and light and works with your skin can help lock in your natural moisture. I love a hyaluronic acid serum. I love it for all skin types because it locks in that natural moisture. If you're someone like me, their skin's a little bit drier, it helps keep what you have. And if you don't really like the feeling of other products on your skin, that's a nice one to do and you don't have that heavy feeling. And then like you said, if you have oily skin, it locks in what you have and you don't necessarily have to put anything heavier on top of that. And then your actives. And you can use a whole bunch of actives, but if you're new to skincare, if you have sensitive skin, I would not recommend that. I would say start with one active that is addressing what you want and need it to address. Retinol is amazing. However, it is not for everybody. It can be really irritating. If you have really dry skin, it may make your skin more dry. That should be for a short period of time. But for some people, it just breaks down that skin barrier and can make your skin can make it look drier, basically. But for some people, it is life-changing. And I would say that's a lot of people. Vitamin C is great if you tend to be in the sun a lot, or because it does have protective properties from ultraviolet rays. And then also it helps reverse some of the brown spots. So if you have a few brown spots, maybe not crazy about, that can help lighten those and even out your skin tone. And then we get to peptides and growth factors. And I think those are beneficial, but I think they're beneficial in smaller quantities than what we realize, because even that is their main benefit is the growth factors. These are very large molecules, and so what's actually penetrating the skin is probably a lot smaller than what we think, because it's difficult for that large molecule to get into the skin. What is the answer to that? That is the next step in skincare is exosomes. So exosomes are basically like little envelopes. These are little packages. They look like bubbles that is made out of something similar to what your cell membranes are made out of. And then what is in it is what can affect your skin or your cells, any cells. So if you just go Google exosomes, you're going to find a million different things that are very confusing, because it's not the exosome itself that makes a difference. It's what's inside that you're delivering to the cell, because that membrane then fuses with your cell's membrane, delivering those things right into the cell. So you can take a very large molecule and be able to get more inside the cell and have that tell the cell what to do. Whereas if it's a large molecule, you have to have the right sort of protein that's letting it in otherwise. So we've found in research that this is a way that cells communicate with each other. And so it can be a way that a cancer cell can tell other cells to turn into a cancer cell in the bad side of things. So you will find that in your research, but this is also a way that a cell can tell another cell to grow and to regenerate and to do positive things. So it doesn't matter that the exosome is good or bad. It's not. It's neutral. It's nothing. It's what's inside. And so there is skincare that's coming out that has exosomes in it that you can put peptides in, you can put growth factors in, and you can tell those cells that are not in the growth phase or that are kind of waning in their life cycle that, hey, let's wake up and let's, start turning over and act more like a young cell. The topical skincare is still early in the production and research and all of these things. And so there are no exosomes that are FDA approved. So that is important to know. So the FDA has not done enough studies to say they're safe and efficacious. Doesn't mean they're not those things. It just means that those studies have not been done as of yet. For topical products, it's not as rigorous. They don't require that necessarily. And so these are things that you can put on the market, you can get benefit out of. So the majority of skincare is not FDA approved. So it's the same as the other as far as that, but just know that you can get a little bit more out of it scientifically, and the research is still in the beginning of what we can do with this. There are exosomes that we use in clinic that, again, none of them are FDA approved, but they do have studies showing that they are safe, that they are efficacious, that they are making positive changes for people. They just haven't been done by the FDA or approved by the FDA. But these are a little bit more specific. And I really like using them with things like microneedling with RF, where you're making channels in the skin to deliver these little envelopes to the cells that you need down into the dermis to regenerate, to make your skin look better, more youthful. And that topical application is allowed and is fine as far as the FDA goes. You can't inject them technically just yet, but that is something that is on the horizon that they're doing more studies about. So the skincare we have is good, and it's getting better and better as we learn more about how we can not just add stuff to the skin, not just throwing more moisturizer on it, but how can you make the cells themselves actually work better and act more like a youthful cell. So it's very exciting. There's lots of good stuff that's out there, and even better to come. But skincare, I think, is one of those things you have to do. If you're going to do the other stuff, you really have to take care of it at home to get the best out of everything you're doing for yourself and for your skin. So let me know what questions you have about skincare and aging and your skin. I'm Dr. Angela Sturm, facial plastic surgeon. You can find me at www.drangelasturm.com, or you can listen to our podcast, Beauty Unveiled, wherever you get your podcasts.